at WHO yesterday, they were talking about research that was disruptive. So I began the morning by actually saying that I went to a meeting in the British Parliament, and the chair of this committee said, "Hello, Michael, are you going to be your usual disruptive self?" And I said, "I'm going to tell the truth. Does that count as disruptive in this place?" I think it is rather important to tell the truth, which is what I'm going to talk about this morning. I will get to clean air, but I want to put it in context. The first is that the opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. Lord Darcy, at the request of Wes Streeting, the new health secretary, produced a report on the NHS. Vital that we fix the NHS. But Lord Darcy said, and he invited me to a meeting at Imperial a few weeks ago, said perhaps 20% of the health inequalities will be addressed through the National Health Service. The remainder has to be the social determinants of health, of which the environment and clean air are part. And he said that's why he'd invited me to talk about this. In my English review, just to put it in context, I had chaired the WHO Commission on Social Determinants of Health. We published in 2008. The then Prime Minister of the UK, Gordon Brown, remember him? Invited me to conduct a review in England to answer the question, how could we apply the findings and recommendations of your global commission to one country, England? We published Fair Society, Healthy Lives, the Marmot Review, in 2010, and we had 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions. Number 4, it's really radical, late-breaking news from elite universities. If poor people are given a bit of money, their health improves. You need to be an elite university to understand that. If you've got no money, a bit of money is quite helpful, having enough to have a healthy standard of living. Healthy and sustainable places and communities, where the environment comes in, housing, and taking a social determinants approach to prevention. We've now added 2, tackle racism, discrimination, and their outcomes. And yesterday, I'm sure you're up to date, we published Structural Racism, Ethnicity and Health in London, commissioned by the Greater London Authority, trying to put racism, structural racism, on the same plane that we put economic inequalities as an urgent issue to be addressed. And of course, number 8 should have been there all along. Pursue environmental sustainability and health equity together. On February 2020, on the 10-year anniversary of the Marmot Review, we published Health Equity in England, the Marmot Review 10 years on, to see what had happened in the 10 years. And news isn't good. We did a calculation that I'd wanted to do for a long time. People like me are always talking about the poor health of the poor. And the poor do have poor health. The people living in the vicinity of Grenfell Tower, men, had 16 years fewer life expectancy than men in the rich part of the Royal Borough of Kensington and Chelsea. So we talk about the poor health of the poor. I want to talk about the good health of the rich. Not, I hasten to add, water skiing accidents while on holiday in Barbados, but the good health of the least deprived shows us potentially what's possible. If you make the assumption that the social gradient in health, the higher mortality of everybody with a greater level of deprivation above the least deprived, that is excess. The good health of the least deprived shows us what's possible. And what you see here is, of course, the greater the deprivation, the greater the excess mortality. It's a gradient. Over the period from 2009 to 2020, we calculated there would have been 1 million fewer deaths if everybody had the same low mortality of the least deprived. 1 million fewer deaths, 1 million excess deaths linked to deprivation. Now, there was a social gradient before 2010, but after 2010, the gradient got steeper. And we calculated that of that 1 million, 148,000 were excess in the decade of austerity. Arguably, austerity killed 148,000 people. In my 2010 English review, I coined the rather unfortunate phrase proportionate universalism. Very relevant when the new government announced it was going to target winter fuel payments to the worst off. That's a classic Anglo-Saxon approach to social policy. You means-tested benefits, you target the worst off. A more Nordic approach is universalist programs, things for everyone. So, classic British compromise, I tried to combine the two and said, let's have universalist programs with effort proportionate to need. Call it levelling up. So if this is, let's say, less distribution, less destitution, deprivation, greater affluence, higher mortality. If you focus only on the worst off, you miss the health disadvantage of those who are above the index, above the threshold. So we said, universalist programs with effort proportionate to need. You can see why I'm not a politician. Can you imagine going to the barricades with a banner? What do we want? Proportionate universalism. When do we want it? In the fullness of time. What did we get post-2010? We plotted life expectancy for each local authority in the country in 2010-12. And then we looked at the percent change in government funding per head of population over the next 10 years. And what you see is the shorter the life expectancy in 2010-12, the steeper the reduction in government funding. I look at this, and the kindest explanation I can give for this was absent-mindedness. They didn't know what they were doing. I'm being kind now. But it doesn't look like absent-mindedness, does it? It looks rather systematic. It's graded. The poorer the community, the greater the reduction in local government spending. In what moral universe could that be the right thing to do? And then you get surprised if the decade of austerity implemented in a regressive way leads to worse health, greater inequalities, and a decline in life expectancy in the poorest areas. Challenges. Child poverty. Child poverty defined as less than 60% median income. We're high in the UK. US always looks worse than us on everything. And if you look at the change over the period from 2012 to 2021, the UK had the biggest increase of 38 mostly rich countries as a result of government policy. The government said, we'd like our children growing up in poverty. Well, they didn't say that. They said, we've taken hundreds of thousands of children out of absolute poverty. I won't spoil your morning by telling you how they defined absolute poverty. But if you look at the way Joseph Rowntree Foundation defined it, as destitution. And destitution is doing without 2 or more of 6 basics: housing, heat, light, food, clothing, and toiletries. In the UK, in 2022, 1 million children were growing up in a state of destitution. And that was a 2.5-fold increase in only 5 years. And former government ministers would get up and say, oh, we've taken hundreds of thousands of children out of poverty. They're being admitted to hospital with scurvy and rickets. And if you happen to be on benefits, you're in bad shape. The Joseph Rowntree Foundation and the Trussell Trust calculated the cost of essentials, like those 6 I mentioned, and universal credit for a single person or a couple. That's the cost of the essentials, and that's what you get on universal credit, about 70% of what you need to lead a healthy life. We guarantee if you're on universal credit, you will get sick because we won't give you enough to live on. And if you're in work, the majority of people in poverty, so there's the UK, that's the UK, after housing costs, the majority of people in poverty, 68%, are in households where at least one adult is working. Work's supposed to be the way out of poverty, but it's not if you're lowly paid. I'm getting closer now to energy. It's not good to be poor in Britain. If you're in the top 10% of income in France, you pay about 6% of your household income on energy, home heating. And if you're in the top 10% in the UK, you spend about 6% of your household budget on energy. If you're in the poorest 10% in France, you spend 10% of your household budget on energy. If you're in the poorest 10% in the UK, you spend nearly 18%. That gap between the poorest and the richest and the percent spent on home energy is bigger in the UK than in any other European country. The UK is not a good place to be poor. And we need to pursue environmental sustainability and health equity together. The Climate Change Committee asked me to chair a small group to produce a report on how actions to improve health and to reach net zero could work together. Because they asked me, I made it health equity, not just health. And we talked about transport, buildings, diet, work and employment patterns. And running through all of this is air pollution, which is absolutely vital. Take action for net zero and you will get cleaner air. Take action to get cleaner air and you'll be making progress towards net zero. We published a report, one of several, the latest of several reports, on cold homes left out in the cold. Fuel poverty has 3 causes: the thermal property of the dwelling, poverty, and the cost of fuel. Insulation, we have one of the worst in Europe. Over 50% of homes need upgrading. If you need more energy to heat your home, and that comes from fossil fuels, you're not doing well for air pollution or the environment. Real wages have flatlined since 2011, and for reasons that I suspect have something to do with the way we privatized energy, the cost of fuel is 30% higher than the European average. So there's the poor levels of insulation. The UK, this is home temperature loss after 5 hours compared to our European neighbours. cold countries like Norway, Sweden, Denmark, they know how to insulate their homes. Children from low-income households are more likely to live in areas with high air pollution, PM 2.5 levels, and percent of children living in poverty. And in general, the greater the level of deprivation, the poorer the environmental quality. No condition, one adverse condition, two, three or more conditions. It's pretty grim, hey? The second most common question I get asked is, why aren't you depressed? You have to pay to find out what the most common question is, but this is why I'm not depressed. We've been publishing these reports, but places are taking action. By early next year, we will have 50 Marmot places in England and Wales. Coventry was the first, declared themselves a Marmot city. They took in 2010, then 6 domains of recommendations and said, as a city government, voluntary and community sector, the health and care sector, other public bodies, business, we will implement them. Greater Manchester, Build Back Fair in Greater Manchester, Altogether Fair in Cheshire and Merseyside, Lancashire and Cumbria, Luton, Gwent in Wales. It is really exciting. We've been working at local level for 2 reasons. One, because there hasn't been action at national level, so the negative reason. But the positive reason is that's where people live and work. That's where they grow. And the local politicians' care services are much closer to where people live and work. And when I said in introducing this last bit, why am I not depressed? Let me finish with a Welshman. To be truly radical is to make hope possible rather than despair convincing. Let me invite you to join me in making hope possible. Thank you.